There's an old saying, be careful what you wish for. Now, I'm going to alter that a bit to say, be careful who you market for. Too many dentists are getting almost nothing but low case value patients. If your practice is based on the grinded out dentistry, where you see a high volume of patients, that's fine. But I think you're missing the best part of dentistry, being advanced degreed professional with the freedom to handle more of the cases that you really love to do. I'll be back after the break to tell you why you should move your dental marketing mark. Thanks for watching the Patient Attraction Podcast. I'm Colin, receiver. Now, unless your practice serves a very economically depressed area, you have dental prospects with a range of disposable income and insurance coverage. Now, if you want to know what kind of patients your market appeals to, simply look at what you're getting today. Are your new patients consisting of a lot of cleaning and exams, drill and fills, price shoppers, one-off patients, and they don't return? That's a short road to a bad back, a low-value practice, and a retirement that's not going to be what you want it to be. Now, I see this all too often. Dentists competing on and advertising low prices, which brings in low-value patients. As I mentioned in the beginning of this episode, if you're content with working really long hours for not much in return, hey, that's fine. But if you're going to grow your practice while working less, you're going to have to shift your focus of your marketing. Some 20 to 40% of your market consists of prospects with more discretionary income that are looking for a dentist that they know, like, and trust. These better patients aren't influenced by the lowest price. They're looking for something else in a dentist and the practice that they choose. And not all of those patients are going to be big cases, but almost all of them will be extremely loyal to the right dentist when they find him. It's far cheaper to retain that loyal patient than it is to market to attract a new one to your practice. But some of those better patients are going to be big cases too. The full mouth restorations, the cosmetic, the ortho, the implant, the denture cases that you're looking for. Now, just one of those cases should bring in more money than 6 or even 12 of your low-value patients would produce. And as you know, it could be even higher than that. Those better patients aren't going to care a great deal about insurance. Oh, well, sure, they'll use it if they have it, but how much their insurance pays isn't going to be the deciding factor for them. They want what they want, and they'll pay what it takes as long as you're the right dentist for them. And that's what our industry-leading patient attraction system does for SmartBox Dentist. We help them get more and better patients. Now, the vast majority of our dentists work less, enjoy themselves more, and can look forward to a solid retirement. Just ask Dr. Post from Minnesota. She told us, quote, SmartBox has been instrumental in the growth of our practice, going from 250 to 350 new patients per month, contributing ideas for us on marketing techniques, helping us evaluate the effectiveness of how much money I'm spending and where I should spend it to make it the most effective, end quote. Now, if you're tired of trying to drill and fill your way into retirement, if you wonder about your neck and your back, maybe it's time to change who you market to. Check out patientattractionblueprint.com. This is where you can set up a practice discovery session with us. And these are calls that we reserve for dentists who are serious about growing their practice. It is possible to grow a practice that gives you better patients and more freedom. Join me for our next podcast. Until then, keep moving forward.